Rhabdoviridae family. What do I need to know under Rhabdoviridae? Actually, we have two things under it. One is the Lissa virus, one is vesiculovirus. This is not very important. The vesiculovirus causing vesicular stomatitis virus, it's actually an arthropod-borne infection, not important. But Lissa virus causing rabies, again in medicine, is very important, but I'll pick up the most important parts of rabies that you have to know, especially the pathogenesis and the diagnosis is important. So let's get going. So rabies mein, I've got you a tiny little diagram over here with a dog, and you know this is associated with a dog bite. You just need to help me with fill in the blanks of whatever I have written over here. So first and foremost, if this, for example, is a dog and the dog has bitten a person in the lower limb, so where is the virus going to multiply? Ma'am, jo bite hoga, that is going to lodge the virus in the muscle. Okay, once it goes into the muscle, can you tell me which is the receptor to which it is going to bind? Yes, which receptor will it bind to? Acetylcholine receptor. It is going to bind to acetylcholine receptor. And in which direction is it going to travel? You'll say, ma'am, it's going from the lower limb and it's going ulta. It's going ulta backward towards the spinal cord. So this is a retrograde transport. This is a kind of, after binding to acetylcholine receptors, this is going to be a retrograde transport that will occur. Means from the legs you are going towards the trunk. Means you are traveling what? You are traveling centripetally. You are spreading centripetally from the legs towards the center. Centripetally, where is it going to reach? It reaches the spinal cord. Which ganglia of the spinal cord does it reach? It reaches the dorsal root ganglia of the spinal cord. And why has it reached the spinal cord over here? Because it has to ultimately go to the brain. So of course it is going to reach the brain. In the brain, we of course know that it is going to result in the formation of these Negri bodies. Which part of the brain does have Negri bodies? There are two parts. One is hippocampus and the other is the cerebellum. This is where the Negri bodies are going to be seen. Tell me one more question. Ab Negri bodies brain mein hota hai. Brain though of course autopsy ke time hi you will see, right? Is there any stain for the Negri bodies? Number one, Negri bodies are seen in cerebellum, hippocampus. Number two, Negri bodies are going to be stained by what stain? There is a stain by the name of the Sellers stain that you have to know. So Negri bodies, Sellers stain. Okay, after it has reached the brain, now it will start moving out. It will start spreading to different parts of the body. Matlab outward movement, matlab it is going to spread centrifugally. It is going to spread centrifugally to what all parts can you see over here? Ma'am, I can see it has gone to the cornea, that is the eyes. I can see it has gone to different glands. I can see it has gone to the nerves. It can also go to the skin and the hair follicles. Yes. So it can go to all these parts, guys. It can go to all these parts. That is, it can go to the eyes, the salivary gland. It can go to the skin. That is why after a while, if I will ask you that how do you want to do the diagnosis, you will say that for doing the diagnosis, the best specimen that we can take is the hair follicle at the nape of the neck. At the nape of the neck, the hair follicle is the best specimen. And how do you do antigen detection? By direct immunofluorescence, DIF. So remember, based on this, why? Because pehle to virus brain tak gaya. After going to the brain, it has gone to cornea, it has gone to salivary gland, it has gone to the skin. So from the skin, you can take a sample, hair follicle at the nape of the neck. All of this is said and done. So let me repeat. First and foremost, the dog was biting in the muscle. Which receptor was it binding to? Acetylcholine. Which direction is it getting transported? Ma'am, ulta ja raha hai. It's going in a retrograde manner. And where is it reaching? Dorsal root ganglia of the spinal cord. After that, it is going to the brain. From the brain, it is spreading outward to the eyes, salivary gland and the skin. At what rate is this happening? Anyone who can tell me that? Spread of rabies virus progresses in axon at the speed of 3 mm per hour. This is just general. Ab this they have calculated from the lower limb. Yahan se agar dekho to it will take 3 mm per hour to go. But imagine, for example, it was taking, say for example, few hours, 10 hours or 12 hours or 20 hours. But if a person is very short-heighted, don't you feel that if a person is short-heighted or if the bite occurred on the upper limb, the timing to reach the brain is lesser. From the lower limb reaching the brain is too much. From the upper limb reaching the brain is lesser, right? So for the upper limb, the timing spread time will be shorter. In children are small heighted, so in them the spread time will be shorter. So remember, for children, short heighted people and upper limb bites, the speed or the progress is going to be easier, or you can say it's faster for the virus to move up because it's not going to have so much of distance to travel. But yeah, this is a question. The speed is 3 mm per hour. On that note, definitely the Rhabdoviridae family comes to an end. So let's begin with the arboviruses. And what do we know under it? The name itself is explanatory. So if you look into it, it is an arthropod bone virus. So some kind of vector is going to be involved over here. So let me tell you a quick overview of what all viruses come under it. Bunya virus, Toga virus, Flaviviridae, Reoviridae, as well as Rhabdoviridae. Have you already studied Rhabdoviridae somewhere else? Rabies. Rabies is not arthropod bone. You know rabies is because of dog bite and animal bites. But there was a part of the rabies viridae family known as vesicular stomatitis virus, that is arthropod bone. Similarly, I'll be teaching you in a while what is Reoviridae. Reoviridae is nothing but rotavirus. Rotavirus is diarrhea wala virus, that is not arthropod bone. But there's another member in the family known as Colorado tick fever. Tick is definitely arthropod bone. So some viruses of these families are put in over here. Then comes Bunya virus. Then comes Toga virus. Toga has always reminded me of, do you guys remember? I'm sure all of you have seen a Tonga car. Tonga car has a horse on the front and a cart on the back. You can quickly go through this. Yes, so what exactly is a Tonga car? So Tonga will definitely remind me of Toga virus. And car, I first and foremost know Tonga is going to have a horse. So all the horse related diseases are going to be here. So equine, Eastern equine encephalitis, Western equine encephalitis, and other than the horse, we have C and we have R. What is C and R? So that is going to be chikungunya and rubella. So repeating, Tonga car will remind me of horses. So all the equine encephalitis, chikungunya and rubella. But now I hope you know the rubella has been reclassified into which family? I've told you so many times in this rapid review. It is now a part of the Maternaviridae family. Okay, other than that, we now have another virus family called Flavivirus, and this is what you have to study in maximum detail. You have Japanese encephalitis, yellow fever, Zika, dengue, then we have West Nile fever, even hepatitis C virus comes under Flaviviridae. Go back to your hepatitis chapter. Remember, private hospitals favor rich clients, favor Flaviviridae. Flaviviridae was hepatitis C. So now let us know the ones which we have to know in a little bit more detail. What am I going to teach you? I'm going to start. See, rubella हमने already कर लिया. Equine you need to know कि horse related है and encephalitis है. That is more than enough. What you need to know is chikungunya to begin with. But do you want to do one more summary table and know which of them are what kind of arthropod? Aedes है या फिर Culex है? Should we make a list? Okay, let us start. Let us make a list of all the ones that are transmitted by Aedes. So how are you going to learn? You are going to write Aedes cried. Aedes mosquito cried. So when you write Aedes, I have emphasized on some alphabets. Aedes. So E's, Eastern equine encephalitis. Eastern equine encephalitis. Z, Aedes will remind me of Z for Zika virus. Then we have C for California encephalitis. C for chikungunya, R for Rift Valley fever, Y and D, I think everyone knows yellow fever and dengue fever are transmitted by Aedes. So repeating once again, when you write Aedes, Eastern equine encephalitis, Zika virus, California encephalitis, then you have chikungunya, Rift Valley fever, yellow fever, dengue fever. These are all associated with Aedes. Whereas what is associated with Culex? So remember, Culex I have learnt as cute, and we have learnt Japanese and Western females are cute. Okay, so what is Japanese and Western females are cute? So Japanese, of course, will be Japanese encephalitis. Western, of course, will be West Nile fever. So these are quite simple. And finally, females say you are gonna learn F for filariasis, Buscheraria bancroft. These are all transmitted by cute for Culex. So remember once again, that's quite an interesting mnemonic. So Japanese encephalitis, West Nile fever, and then you have females के साथ filariasis and cute for Culex. So you know what are the ones by Aedes, you know which are the ones by Culex. Now you're going to go ahead and also learn all of their incubation periods in one go. So when I talk about incubation period, if you look at dengue is something which has 5-6 alphabets, so incubation period is 5 to 6 days. Chikungunya pura to dekho hardly anyone says. We always say there is chick fever or chikun has happened. So chikun also, if you say, it has approximately 5-6 alphabets, so there are 5-6 days incubation period. Now when I talk about the yellow fever, So yellow also, if you read, has approximately 6 alphabets. So again, 3 to 6 or 5 to 6 days is the incubation period. Kaisanur forest disease. So if you write Kaisanur forest disease, can I write it as Kaisanur forest disease? Because forest disease will tell me that the incubation period is 4 to 8 days, right? And finally, the Japanese encephalitis, which is the longest name, Japanese encephalitis, 5 to 15 days. Let's do a recap of this because I know you liked the mnemonic, but you need to revise it once. All the things with 5-6 alphabets like dengue fever, like chikungunya, like yellow fever, all of these are 5-6, 5-6, 5-6 days. Kaisanur forest disease is going to be 4 to 8 days and Japanese encephalitis is 5 to 15 days. So the vectors are done, the incubation periods are done. Now we can start off with the one that we have to know in detail. Chikungunya, nothing very fancy about it. I think you already know that Aedes is the vector that you studied. Aedes, cried, chikungunya. Number one, you know that this is not just fever, but there is joint involvement. Joint pain and joint involvement happens in chikungunya. Apart from that, in dermatology, you are asked about this chick sign. What is chick sign? Can we all see the hyperpigmentation over here? So देखो ये तो simple है ना, that chick sign will be seen in chikungunya. This question no one will ask you. This you already know. They will ask you what is the chick sign. So chick sign is nothing but the hyperpigmentation that can be seen usually around the nose after chikungunya recovery. So please remember hyperpigmentation post chikungunya, that is the chick sign. So chikungunya is done. Now let's go on to the Flaviviridae family. Under this, the first one that I'll want to teach you is Japanese encephalitis. I've tried to make one flashcard for Japanese encephalitis. So what all do you see over here? Number one, I can see a mosquito, and I know the mnemonic Japanese and Western females are cute. So which mosquito must this be? This must be Culex. So now one way I see a Culex, and over here I see some cycle happening with a bird. So Culex bird wala cycle is happening. And over here I see a pig. So I have a cycle of Culex pig also happening over here. So what are these transmission cycles? Let's quickly go through it. So please note, over here I can notice, please note over here, there is the vector which is Culex. Kaun sa wala Culex? Culex Triteniorhynchus. All over the world, Triteniorhynchus. But in India, Culex Vishnui. Vishnuji always reminds you of Hindu mythology. So Vishnuji with India. Okay, so Culex Vishnui is common in India and Culex Triteniorhynchus is all over the world. I have a Culex over here, fine. Apart from that, I see these birds. You know what are these birds? These are the reservoirs. They are known as the Ardid birds. This is the natural cycle that happens. But if you have to amplify, so dekho, amplification ke liye pigs are going to be there. So this cycle that is happening over here is the amplification cycle between the pigs and the Culex. So simple. If they have mentioned the Culex and the birds wala cycle, that is the natural cycle. Culex and pig wala cycle, that is the amplification cycle. That is Japanese encephalitis life cycle. What is the question that is asked? Encephalitis, the word is telling me that a patient will have encephalitis. But what is the vaccine that they ask you? There is SA-1414-2 vaccine, which is a live attenuated vaccine, which is most commonly used in India. So SA-1414-2 yaad rakhna hai. Other than that, there is an inactivated vaccine known as Nakayama and Beijing strain. Nakayama and Beijing sounds like Japanese words. So Nakayama and Beijing strains are also used as an inactivated vaccine for Japanese. I hope you are not confusing it with the Nagayama spots. Guys, where did we study the Nagayama spots? If you remember, Nagayama spots were a part of that 6th disease, Roseola infantum, HHV6, human herpes virus 6. That is what had Nagayama spots. What I'm saying over here is Nakayama. Nakayama and Beijing strain is for Japanese encephalitis. So Japanese encephalitis, tick mark. Next, what we come down to is going to be yellow fever. So what is it about yellow fever? If I ask you what is the vector, you will say, ma'am, you had a mnemonic where you said Aedes, cried. Cried may obviously we had picked up yellow fever also. So the Aedes aegypti is the vector. What is so yellow about it? Yellow matlab it is causing jaundice, and if it is causing jaundice, this means there is a hepatic involvement. That is only when something can cause jaundice, right? So hepatic involvement will occur. So how will I do the diagnosis of this? Number one, you can do the antibody testing, means IgM antibody will be detected in the early course of the disease. An IgG antibody will be detected in the late course of the disease. So one is antibody detection, but this you will tell me. What is the cytopathic effect? Cytopathic effect means what bodies are seen. Cytopathic effect. Can you remember yellow fever? I have taught you this under general virology. So I had taught you that yellow fever may we are going to have Tories bodies. Yellow fever is going to have Tories bodies, and that is what you need to remember. Very, very important point about yellow fever. But now tell me, yellow fever is endemic to some countries, and in India, yellow fever does not exist. So imagine someone traveling from Africa or America where yellow fever exists, and that person is coming into our country. Our country doesn't have yellow fever, so there is a risk that we and our population can get it. So how do we maintain the fact that we have to remain yellow fever free? So the India status is that we are free from yellow fever. Why? Because we have made a rule that anyone who is traveling from an endemic zone has to be vaccinated. Number one, it is essential that a person is vaccinated. The vaccination certificate leke aao. If the person is unvaccinated, we make sure that the quarantine of 6 days is maintained. Why 6 days? Because yellow has how many alphabets? It has 6 alphabets. Remember, the incubation period was 3 to 6 days, which means that if someone has to have yellow fever, he will start manifesting it maximally by the 6th day. So we make sure we isolate and we quarantine a person for 6 days only if he or she is unvaccinated. Also, because we know that yellow fever has a vector that is Aedes aegypti, so we will make sure that the Aedes aegypti index is less than 1 around all the airports, the seaports, and the routes of entry into our country. We've made sure that the Aedes aegypti index is less than 1. That is how we have managed to keep ourselves free from yellow fever. But now you said that acha ek vaccine hota hai. So obviously there will be a question on vaccine. Which vaccine is there? There is a vaccine called the 17D vaccine. PSM question. 17D vaccine is a live attenuated vaccine. Live attenuated will always mean that you cannot give it in immunocompromised people. This is going to be contraindicated in immunocompromised individuals. Second, this vaccine is prepared from allantoic cavity. Allantoic cavity means egg. Vaccine is being prepared in an egg. It has an element of an egg. So can I say it is contraindicated in all the people who are going to have an egg allergy? That makes sense. So 17D vaccine, live attenuated, prepared from allantoic cavity. Do not give in immunocompromised people. Do not give in people with egg allergy. And please remember that once, like today, if someone gets vaccinated, when will he get his certificate? The certificate will be given within 10 days. And what is the validity of that certificate? Earlier, they used to say 35 years or so, but now the validity is said to be lifelong. So remember, within 10 days it is issued and it is lifelong. That is why I said someone comes to you with a vaccine, you let him into your country. Someone does not come with a vaccine, then you have to quarantine for 6 days. That is all about the very famous, yes, yellow fever. Let's move on to another disease. The other disease that we have is the famous monkey fever or Kaisanur forest disease. And I think I've already told you that with forest disease, you know that the incubation period is going to be 4 to 8 days. Kaisanur forest disease. What is this life cycle showing you? I can see a hard tick as the vector. So yes, there is going to be a hard tick. And I can see monkey as the amplifier host. No wonder it is called monkey fever. Monkey fever will have monkey as the amplifier host. It is going to have a hard tick. And can you see the hard tick is such that it is transferring it via eggs to its progeny also. The tick is also giving it like inheritance, like property. He is giving the virus further and further to his children also. So it's constantly going on in the tick cycle. It can involve or cause amplification in the animals also, especially monkey. And then the transmission is going to occur. Can you see? Either we come in contact, we all can notice, either we come in contact with one of the animals, or there is a possibility that there can be a tick bite also. Both of them are possibilities that you have. So number one, there is a tick bite ka possibility. There is coming in contact with the animal. That is the possibility. But is there a person to person thing? No. We made it very clear in the beginning कि forest wala disease है, forest से ही आएगा. Either it will come from a tick or it will come from a monkey. It's not going to come as human to human. So there is no person to person transmission that is going to occur. So yes, on that note, monkey fever is done. We move on to the next one, and that is a previous year exam question. That is the Zika virus. Now we all know Aedes cried, so we know the vector over here is the Aedes mosquito. We can see the Aedes mosquito over here, and that is the vector. So a human being has definitely got it. But what are the routes other than Aedes? How does it transmit? I can see mother to child transmission over here. I can see sexual relationships also resulting in transmission, and I can see blood transfusion also happening that can result in transmission. So Zika virus can transmit from mother to child via close contact as well as via blood transfusion. But there was a question, especially mother to child se related, they ask you questions. What happens in the mother and then what happens in the child? Both clinical spectrums of Zika virus you have to know. So in the mother, I can see the heart is definitely pointed here. So cardiac abnormalities hoga. Then I can see the muscle is pointed out over here and the joints are pointed. So muscle pain hoga, joint pain hoga. There is myalgia, there is arthralgia. I can see there is an element of rash mentioned over here. So rash will be there. And finally, these patients can also have Guillain-Barré syndrome. So repeating once again, cardiovascular problem, myalgia, arthralgia, maculopapular rash, and GBS can occur. Now moving forward, when it transmits into the placenta and it goes into the child, firstly, which cells of the placenta are going to keep it? Previous year AIIMS exam question, and that is the Hofbauer cells. I hope you remember from pathology, Hofbauer cells are nothing but the macrophages of the placenta. That is how it's going to go and sit over there. And from there, it will go into the child. So what all can it cause in the child? It can cause a lot of optic, or you can say the ophthal anomalies can occur, like optic neuropathy and congenital glaucoma can be there. And in terms of the skull abnormality, microcephaly has been noted. So eye problems and skull problems, that is what we have with Zika virus. So Zika is also settled. Now the next one, which I believe everyone is anyway aware of, and that is the dengue fever. And dengue fever, of course, the vector is going to be Aedes. Dengue fever ke liye kitna serotypes hai? We have 4 serotypes, that is DEN 1 to DEN 4, out of which DEN 2 is definitely the most dangerous one. So DEN 2 is going to be very, very dangerous. So 4 serotypes are there, but in Bangkok now a 5th serotype has been reported, and that is DEN 5. So I'm sure all of you know that dengue fever is characterized by a decrease in the platelet count. So what are you going to do? We are always going to go in for platelet transfusions. But is that the only thing that is altered in the blood? No. There can also be an increase in the hematocrit. Basically, these patients are going to suffer from hemoconcentration. The plasma loss, the water of the blood is going to get lost. So when there is plasma loss, the blood becomes very, very concentrated. Means the hematocrit will increase. Means you have a patient of dengue, and what are the 2 things that you have to follow up? Number 1, you have to follow up the platelet count. Number 2, you have to follow up the hematocrit. So the platelet count will fall and the hematocrit will increase. That means you are going severe and severe. So how do you think you're going to diagnose it? Of course, we are going to diagnose it by antigen testing. Antigen ka kya naam hai? NS1 antigen. See, let me tell you, there are 2 antigens which are their all-time favorite antigens. One is an NS1 antigen. Of course, you know this is going to be for dengue fever. One is an RK39 antigen, which we know is for Kala Azar or Leishmania. So these 2 antigens in our country are the most frequently studied antigens because the predominance of these diseases is much. So remember, NS1 antigen testing karte hain. Of course, you can do antibody testing also. Antibody testing is done for IgM using something known as MAC ELISA, but then nothing can beat genetics. Although for dengue, honestly, you don't need genetics because antigen antibody is good enough to make the diagnosis. But I had to copy paste PCR everywhere, and I have done that. I hope everyone's okay with this because all your arthropod-borne infections are sorted.